Have you ever heard someone say, "I'm on Medicare," or "Is it Medicaid?" A lot of people mix these two up. They sound almost identical. They're both government health care programs. They both help millions of Americans get coverage. But Medicare and Medicaid are actually very different programs with different rules, different eligibility requirements, and different types of coverage. Understanding the difference is extremely important, especially if you're approaching age 65, helping a parent navigate health care, or trying to understand what options may be available. Hi, I'm 𝗫𝗓𝗃, and I'm a licensed insurance agent at the Senior Savings Network. In this video, we're going to clearly explain what Medicare is, what Medicaid is, the key differences between the two programs, and how some people actually qualify for both at the same time. Let's break it down. Let's start with Medicare. Medicare is a federal health insurance program primarily designed for people who are age 65 and older. However, some individuals under age 65 may qualify if they have certain disabilities or specific medical conditions. Medicare was created in 1965 to help older Americans gain access to health care coverage during retirement. Today, it covers over 60 million Americans. Medicare is made up of different parts. Each one covers different health care services. Part A is often referred to as hospital insurance. It may cover things like inpatient hospital stays, skilled nursing facility care after a hospital stay, hospice care, and some home health services. Many people qualify for premium-free Part A if they or their spouse worked and paid Medicare taxes for at least 10 years. Part B is medical insurance. This helps cover services such as doctor visits, outpatient care, preventative services, and certain medical equipment. Unlike Part A, most people do pay monthly premiums for Part B. Prescription drug coverage is generally available through Medicare Part D, which helps cover many prescription medications. Plans vary and are offered through private insurance companies approved by Medicare. Some individuals may choose to add additional coverage options to help with out-of-pocket costs. These may include supplemental policies or other Medicare plan options offered through approved private insurers. The key takeaway is this: Medicare eligibility is primarily based on age or disability, not income. Anyone can qualify for Medicare simply because they're 65 or older. It doesn't matter what your bank account looks like. Now let's talk about Medicaid. Medicaid is a healthcare program designed to help individuals and families with limited income and financial resources. Unlike Medicare, Medicaid is not based primarily on age. Instead, eligibility is generally based on financial need and certain other factors. Another important difference is that Medicaid is jointly funded by the federal government and individual states. Because of this, each state administers its own Medicaid program, which means eligibility, rules, and benefits can vary depending on where someone lives. Medicaid programs may provide coverage for services such as doctor visits, hospital care, preventative services, long-term care services, nursing home care, and in some cases, additional health care benefits that Medicare may not cover. Medicaid can serve several different groups, including low-income adults, children, pregnant women, individuals with disabilities, and seniors with limited financial resources. Because the program is state administered, the exact income and resource limits may differ depending on the state. Here's something that surprises many people. Some individuals actually qualify for Medicare and Medicaid. This situation is referred to as being dual eligible. Typically, this happens when someone qualifies for Medicare based on age or disability, but also meets the income and resource requirements for Medicaid. When someone qualifies for both programs, Medicaid may help with certain costs that Medicare does not fully cover. Depending on eligibility, Medicaid may help with things like Medicare premiums, deductibles, co-payments, and certain additional healthcare services. Programs that assist with these costs can vary depending on state guidelines and individual circumstances. Understanding the difference between Medicare and Medicaid is important because confusing the two could lead to misunderstandings about what coverage you may qualify for. To summarize the main differences, Medicare is primarily based on age or disability. It's a federal health insurance program and typically begins around age 65. Medicaid is primarily based on income and financial need. It's a joint federal and state program, and eligibility rules can vary by state. In some situations, individuals may qualify for both programs at the same time. Healthcare programs can be complicated, but understanding the basics can make navigating them much easier. If you found this explanation helpful, give this video a like, subscribe to the channel for more educational videos about Medicare, and check out our other videos where we break down Medicare topics in simple terms. I'm Jennifer Paxton. Thanks for watching.